Hi, I'm Jonah Comstock, Editor-in-Chief at PharmaForum, and I'm here at ASCO 23 in Chicago. I'm joined by Dr. Corina Dutcus from Eisai.
Yeah.
You're a Senior Vice President there?
Yes, I'm a Senior Vice President in Advanced Clinical Development Group in Oncology.
So, first thing we want to talk about a little bit is the big Eisai news at the show in kidney cancer, right? In renal carcinoma. So tell me a little bit about that trial and what you're here talking about.
Thank you, Jonah. So we are going to, on Monday, there'll be an update, a 4-year update, a presentation of the final pre-specified overall survival analysis for a very important trial for the renal cell carcinoma patients, and that's the CLEAR trial, where patients got randomized to 3 arms, one of them being lenvatinib plus pembrolizumab, the other one lenvatinib plus everolimus, and the third one, the comparator, was sunitinib. So, as you know, the primary analysis of the trial showed a very meaningful improvement, clinically and statistical improvement in overall survival, progression-free survival, and response rate for patients with renal cell carcinoma. And that led to the approval of Lenvima plus Keytruda in first-line renal cell carcinoma. Now, at 4 years of follow-up, we will present an update, and this is again pre-specified final overall survival analysis, which shows clinically meaningful, robust improvement in the overall survival with Lenvima plus Keytruda versus sunitinib. In addition, there is a very impressive and clinically meaningful improvement in progression-free survival and response rate and complete response rate with Lenvima plus Keytruda. Essentially, the risk of death, as shown by the overall survival, is reduced by 21% at the 4-month follow-up, and that shows very robust data. The progression-free survival with Lenvima plus Keytruda is 2.5 times larger than with sunitinib, so that's a very big time improvement for patients in first-line renal cell carcinoma, and one of the best progression-free survival reported with any other combinations. Response rate over 70% remains robust, deep, of rapid onset with Lenvima plus Keytruda, and last but not the least is the complete remission rate. So we are talking about patients that are cancer-free at 4 years with a rate of over 18% for the combination versus around 5% with sunitinib. So these are all really very exciting data. The safety are consistent with what was reported in the primary analysis that led to the approval. So essentially, these are great news for the patients with renal cell carcinoma that have a very, very excellent first-line treatment option for their disease.
So Keytruda, the Keytruda piece from Merck has been like a real blockbuster in many different kinds of cancers. What is it about kind of renal cell carcinoma that has made it sort of a more difficult kind of later in the process, to decide to use that drug there? And tell me about like what makes this combination work. Why do you need the Limparsa piece? And yeah, how did we get here?
So this is really a very important question for everyone. So thank you. So renal cell carcinoma is one of the tumors that have a very high expression of VEGF, vascular endothelial growth factor. Lenvima is a targeted therapy targeting the VEGF receptors 1, 2, and 3, in addition to FGFR 1 to 4, PDGFR, KIT, and RET. So it is, we believe, the best targeted therapy, tyrosine kinase inhibitor, and definitely a very potent inhibitor of the VEGF receptors, which are expressed at high level in renal cell carcinoma. Keytruda is a checkpoint inhibitor that essentially works on the immune system, helping the body's immune system to fight against the cancer. And the combination has been proven not only in preclinical studies, but over and over in our clinical studies, especially in renal cell carcinoma, that it works um, by complementing each other. So Lenvima, in addition to its anti-tumor activity, and anti-angiogenic activity against the VEGF, also in combination with Keytruda, has been shown to decrease the tumor-associated macrophages and increase the cytotoxic T cells that help Keytruda to essentially fight against the cancer cell. And you can see that with the combination, the anti-tumor activity exceeds the activity of each of these agents alone in renal cell carcinoma, for example.
Yeah. So it really is kind of that team effort.
It's a team effort, and it is what we believe the combination of the best TKI with the best checkpoint inhibitor. And you can see this is, in a way, it's a testament of our commitment to the oncology. It speaks for our human healthcare philosophy that our company puts above everything we do, where the patients and people come first. And it speaks very clearly for our passion and desire to bring new treatments to the cancer patients. And collaboration is something that we certainly encourage, because there is great talent at Eisai, but when you combine with another and collaborate with another company, there is always something that you can learn and do better.
What are some of the kind of trends and interesting things you've heard at the show? You come here obviously to bring your own data and to tell people about your successes, but you're also seeing what other folks have been working on in the same cancer area, in other cancer areas. So I know we're early in the show, but how has it been for you so far at ASCO? What have you kind of been seeing and hearing that's interesting?
So I think this ASCO is very exciting. There is a lot of new data brought in different tumor types, different line of treatments, a lot of new class of drugs. All is really very good for the patients, the cancer patients. From our point of view, and I can speak for Eisai, we are here with different presentations across different tumor types, and again across our portfolio, indicating, again, the fact that we are very committed to contribute to the quality of life, to the treatment of patients that are suffering from cancer. Different type of tumors.
I've been asking everybody a little bit about right now when it comes to sort of the technology that you use to do your work, digital technology, artificial intelligence. Are you starting to see that have an impact on oncology, and how do you see that sort of shaping up in the future?
Yeah, and right. I think this is like the next must step for everybody in drug development to move on, because you can progress so much faster and you can learn so much better. So as a proof of that, Eisai is opening a new chapter in our storybook, and that's called Deep Human Biology Learning. And essentially what we are doing right now, we emphasize the need to go deep into the science, to have a deep understanding of the science, and then translate that understanding into new ways to discover and develop drugs using AI and cutting-edge platforms and technologies that will make it more efficient what we do every day.
Anything else that we haven't talked about yet about the CLEAR trial that you're excited about in terms of the findings, or anything that you want to really dig into or emphasize?
Well, a CLEAR trial, I think it's a very excellent representation of our work, the quality, the commitment, the passion, and the desire to really bring robust data that will truly help, will be meaningful to the cancer patients. And you can see here, you have a 4-year follow-up with such a great improvement in the overall survival that remains consistent at 4 years. And again, clinically meaningful improvement for progression-free survival, overall survival, complete remission rate. That is really something that 10 years ago nobody even was able to talk about. So these are excellent news for the cancer patients. And what we plan to do is to now learn what we can do better. We are not going to set up here. We will push ourselves and look into how we can do better and better for our patients.
It seems like generally at the show, one thing I'm hearing a lot is this emphasis on the sort of de-escalating, this idea that because we have these powerful oral drugs that, you know, operate, which patients can we do less chemotherapy on, which patients can we do less radiation on? How can we think about not just survivorship, but also like quality of life and toxicity and things like that? So is there a piece of that here in terms of like the standard of care and you know what this could mean for patients with kidney cancer? Is this potentially kind of going to keep them from having to have more sort of onerous and damaging kinds of treatments?
The quality of life, yeah. And this is something that is in our mind every single day. And everything we do, we look at that because safety is important, but quality of life is extremely important. And you always have to balance between efficacy and safety, especially quality of life of these patients. So what we have done from day one with Lenvima, we developed a very um, deep and I would say quite simple algorithm, essentially, and train the world that this is one drug that is an oral drug and that is not adjusted by the dose, by the body surface, by the weight. So it's possible that one size doesn't fit all. If your patient tolerates it, that's fine. But if the patient does not tolerate the drug and there are adverse events, it's okay to interrupt, treat the adverse event, and then reduce the dose. So this dose reduction is something that we have worked over and over and over with investigators. And I see every time I come to ASCO great progress in that respect. I think it's a great progress for our patients. And now, to your point about quality of life, we have learned from Lenvima and in our pipeline, we apply measurements such as patient-reported outcomes and quality of life measurements from the very early stages. We don't wait for a phase 3 to look at it. Even in phase 2 and early, phase 1b/2, when we can randomize to, let's say, 2 dose levels for the same drug, we look at the quality of life. And that's a very important factor in deciding which dose we are going to choose to move on with.
Well, thank you so much for chatting with me, Dr. Dutcus. This has been very interesting, and congratulations on the positive results. I hope that you get a good reception on Monday.
Thank you. Thank you so very much. Nice meeting you.